Hello. So we're still working on the results and the discussions. And let's redo this. We have so far talked about the results and discussions for the qualitative designs. And I'm hoping we can take a look at the quantitative piece. The quantitative piece is going to be in 2 or 3 segments because that's a bit lengthier. So let's see what the requirement is. Remember, as always, that this is a golden thread of research. And so what we talked about in chapter 1 concerning the research objectives, the research questions, then hypothesis, for those of you who are doing quantitative, comes in during the results section. So I have the research objectives, questions, and or hypothesis for 2 of the students I'm working with. And let's see if we can make some sense out of this. Okay. One of the things that generally we look at is objectives. And objectives, for me, I'll say that when you turn objectives into question form, it becomes the research questions. I stand to be corrected, but I have found that consistently that's what's happening. In qualitative studies, objective is supposed to be really huge, and then the research questions coming from under that become smaller to feed into the objectives. I have historically been doing quantitative studies a bit differently. So when we talk about, for example, one of my students' research objectives is like, by the end of the study, readers will understand baseline characteristics of trainee nurses in terms of symptoms, distress differences based on intimacy. And so this is a student who took, for his study, he did an intervention study looking at cognitive behavioral therapy, solution-focused therapy, and no therapy at all, and applied these interventions on training nurses to figure out if it would reduce or increase their symptoms distress. And the students used the OQ45 to do this assessment. Now, when you come to this, so the objective is to look at these differences. When you are looking at these differences, your analytic test is a one-way analysis of variance or ANOVA. And what you are reporting when you do that analysis is the F statistic. You're reporting the degrees of freedom, the p-value, the effect size. And then if there are differences among these groups, what you do is you do a post hoc test. Okay. So one of my students this morning, we were chatting, and then we were talking about her study, and she said, well, but somebody helped me with my statistics. I said, I don't have a problem with it because it's not all of us who really understand these things. But for me, even whether somebody helps you or you do it yourself, do you know why they are doing that? So let's assume the person says, hey, you're looking at symptoms distress differences, which is measured on a continuous scale. And you're looking at intimacy status, which is more than 2 categorical groups. The test you have to do is a one-way ANOVA. If I don't know anything about it, I'll go immediately and read about what is a one-way ANOVA? What does it do? What do I report? Why am I reporting those things? So you don't need to know the underbelly of the statistics, but you should know the one that they are doing for your research question or your research objective or your hypothesis and be able to speak to it. If you don't, then I don't think you're really doing any graduate program. Okay, so remember, I'm saying you don't have to understand all the nitty-gritty of the stats, but the ones that are connected with your work, come on, you should know it. The second research hypothesis was no, it wasn't even hypothesis. Was it? Yeah, it was a hypothesis. So the hypothesis was the null. And when you state the null, the alternate is implied. For some institutions, they'll say whether it is implied or not, you should state it. So figure out what works for you. And then when you're presenting, just talk about the null and then write the alternate there, but you don't have to talk about it. So the hypothesis was that there will be no significant mean risk differences between pre-test and post-test scores in CBT, SFBT, and placebo groups. And that one, the student rightly indicated that this was a paired samples t-test or a repeated measures t-test or a dependent samples t-test. So if you're writing one down, but you are presenting, let your audience know that you know that these are all the names for it, okay? And for this kind of study, what you do is you report the gain score, and I'll show you samples of these tables and what they imply, and then provide the t-statistics and the p-value. I think this one should also have, I was going to say a Cohen's d. So anytime you provide a t-statistic and a p-value, you have to provide the effect size. The second one is a different study, and the student wanted to look at, the question was, so she used research questions and not objectives. So what she said was, what type of complicated trauma is experienced by adolescents living in informal settlements? And she used a particular type of instrument. So what she said was, we're going to use descriptive statistics, and I'm going to report the frequencies and percentages. So if this part is supposed to be in your chapter 3, as part of what you're going to talk about, when you do that in the chapter 4, when you talk about it, you say, hey, this is answering this objective, or this is answering this. And because you've already said that these are the things you're going to report in the table, you should talk about those. For this particular student, I have a feeling I am talking fast. The student wanted to look at the types of PTSD symptoms. So the question was, how different are the types of post-traumatic stress symptoms that adolescents living in informal settlements experience, or what do they demonstrate? And she decided to use the exploratory factor analysis. I would ask the student, why did you do this? Why didn't you use some other tests? I think for this one, she figured PTSD has clusters within the DSM-5. I want to find out if the clusters that I find with this particular sample is a reflection of what is in the DSM-5. If it is, then it means that any DSM-5 related instruments can assess PTSD in a sample like this one. And what you report after you have done something like that is to provide the factors extracted. You are reporting the Bartlett's test, I think it's called Bartlett's test of sphericity. You are reporting the Kaiser-Meyer-Olkin measure of sampling adequacy, and you have to provide a script plot as a confirmation that what you said you were going to do, you have actually done that, okay? So even though this is supposed to be found in the chapter 3, I want you to have an idea of, hey, these are the things that if I'm saying this is what I'm going to do, then this is what I have to report. Beyond the reporting, now I have to ask myself, if somebody were to ask me, why did you do a one-way ANOVA and not an independent samples t-test? I should be able to describe it. And all these things are connected with your measures class. So within every statistics class, you're going to have a topic on measurement. And measurement is where they teach you about the how are you assessing your participants? Is it on a nominal scale? Is it on an interval scale? Is it on an ordinal scale? Is it on a ratio scale? And these are connected with the types of instruments that we use. And so if it's nominal, then we are using the numbers to describe just male, female, yes, no. It doesn't mean one is better than the other. If it's ordinal, what does it mean? If it's interval, what does it mean? And if it's ratio, what does it mean? So if you don't have a good grasp of those, you will really struggle to be able to speak to this. As always, please read at length, quiz yourself, so when you go and stand there, nobody makes you feel like a moron, okay? All right. Take care of yourselves, and hopefully I'll be able to do the other one as quickly as possible. Have a wonderful weekend. Bye.